Anything else beyond like childhood that's playing a role in this and sleep apnea?
Yeah, kind of continuing forward into adolescence, and we could talk a lot about even with kids, some of the sleep-related breathing issues that we weren't recognizing. ADD, ADHD. 70% of the kids that were diagnosed with ADD, ADHD had a sleep-related breathing disorder.
What?
And we used to wonder. Yeah,
That's
this is really
crazy.
cool.
Oh my gosh.
We used to wonder, why would we give these kids that have ADD and ADHD? Why would we give them Ritalin or Adderall? Those are stimulants. So with these kids that are hyperactive, we're stimulating them. Why?
Right.
And what the research was pretty clear about was those same kids that were diagnosed with ADD and ADHD, 70% of them were responding favorably to those medications. It was helping them with their ADD, ADHD. And that's about the exact percentage that have a sleep-related breathing disorder that was not diagnosed. And so anybody that has kids or has been around kids will recognize, hey, when kids are cranky and tired, they are a little bit hyperactive. They're grouchy. They're not able to focus, and they act out. And so we were taking these kids that were beyond tired, and we were stimulating them back up to their baseline level with stimulants.
Interesting.
And so, yeah, now it's normal practice. If a child has ADD, ADHD, they should have a sleep study because that needs to be addressed and needs to be investigated.
Wow.
That is very interesting.
Okay, so then back to the first part of that question, because I'm curious before we go into like how can we deal with this, is like I'm curious how many people are suffering from sleep apnea or something close to it that are just completely unaware and are just like spinning their wheels trying to figure out how to get better sleep. Or maybe they think they're doing great because, they go to sleep at 9 and wake up at 7, no issue, they think. But what is that like? Do you have a general percentage of how many people?
There about 40 million people, adults in the U.S., are known to have or suspected to have sleep apnea based off of the studies. But even before that, there's a diagnosis called upper airway resistance syndrome. That's basically a narrowing of the airway. And so that one is a little bit harder for us because we have to do some additional testing. But the general consensus is that about 1 out of every 3 adults has some form of sleep-related breathing disorder that is affecting their quality of sleep.
So how can people, because obviously it's very common, 1 in 3, I mean, there's 3 of us here. 1, 2.
Well, you already said you.
I've already been tested.
Okay, there we go.
I haven't been tested.
You guys must be okay, right?
Hopefully, fingers crossed. But how can someone find out? Because it's like what you're saying is you might not even know that you have this. So what are the telltale signs? Is it just that you wake up in the morning, you feel terrible, and you're like, man, I got hit by a truck and I don't know why, I got 8 hours of sleep? Or are there other signs you can look for?
That's one of the more common ones, and especially when we're talking about the upper airway resistance syndrome. That's basically a narrowed airway, and this is a lot more common. We used to look at sleep apnea and we're like, it's just the fat old men that have it. And then what we recognize is that a lot of the petite females that don't have sleep apnea have the upper airway resistance syndrome. That's a narrowing of the airway. So as soon as you get into REM sleep, that airway narrows down. And so that's harder to recognize sometimes because with sleep apnea, you kind of think of, 94% is for percentages. People that have sleep apnea, 94% of them will snore. So you can have snoring but not sleep apnea. But typically if you have sleep apnea, you probably snore.
Sure.
And so that'll be one of the big ones. So if your spouse is sleeping in a different room, you probably have sleep apnea. So the noise is a big one. The recognized apneic events where it's like, hey, you stop breathing. I got to kind of elbow you to get you to start breathing again. Those are the ones that are very blatant. Yeah. Some of the ones that are not as, kind of in your face, for the upper airway resistance syndrome, a lot of times it's hard to even tell that they're breathing. So it can be shallow breathing. Some of the kind of the telltale red flags that we see for patients, nighttime urination. That's an interesting one.
Okay, so like getting up to
use the
night?
restroom.
Okay.
And that's because anytime you have one of those apneic events, your heart rate goes up, your body goes through a panic response. So your heart rate goes up, your blood pressure goes up, and your body releases a peptide that tells your kidneys, hey, we've got too much fluid on board. So during the middle of the night, your kidneys are producing more urine than during the day. So we'll ask questions to patients like that. Heartburn is another one. So gastric reflux. So, and that's kind of think of the airway as a tube. And for those of us with sleep apnea, there's a kink in that tube.
Yeah.
And so your chest diaphragm muscles are still moving, the rib muscles are still trying to breathe air in, but instead of bringing air in easily, you create a negative pressure at the top of your stomach. So you'll actually get that gastric reflux at nighttime, and also you can get what's called laryngopharyngeal reflux. So that's the acidic vapor. So waking up in the morning, we're congested, where it's like, man, I wake up in the morning and I'm congested. It feels like I have allergies. And then by 10 o'clock or noon, everything feels okay and I'm fine. Yeah, so there are a lot of these things that when we start asking patients, some of these questions, they're like, yeah, I do have that, I have that, and we just start like red flag, red flag. Yeah, it starts coming together, and it's like, well, you know what, and even those active muscles, during the nighttime, from an orofacial pain standpoint, and why it affects the pain so much is during the night, if those muscles are activating to help hold the airway open, they can activate with twice as much force at night while we're asleep than they can during the day, because the body doesn't recognize some of the pressure sensors that tell us how hard we're biting down. So they'll wake up in the morning and it's like, my face is tired, my neck is tired, and it feels like your head's been on a treadmill all night long. And you wake up and you just don't feel good. You don't feel refreshed. You wake up just feeling like, the alarm clock's a liar. There's no way I got the sleep that it said that I got.
That's crazy. I did have a question about the nighttime urination.
Yeah.
How many times is too much? Because and the reason I ask is I know that like as people get older, obviously like the kidneys and the prostate function, like people leak a little bit more as older they get. So how many times is too much, and what can you do to kind of like prevent that from happening?
So part of what you have to do to prevent that from happening is just regulating your fluid intake as it gets closer to bed, just so to make sure that you don't have too much fluid on board. And a lot of it is testing. So if you start to have those issues and you start to have some of those red flags, the only real way to know is to get tested. Yeah. And so, like personally, I'll tell a little bit about myself. I got tested when I was 35, and I was like, man, I'm getting up to use the restroom a couple of times a night. And I'm like, is this what it's like to get old? As soon as I had it treated, I don't do that anymore. Really?
Wow.
So, and I haven't for years, because I've had it treated for years. I don't do that anymore. I got off my blood pressure medication. I got off of the omeprazole that I was taking, because of the gastric reflux and the heartburn, and the nighttime urination went away.
What?
That's
crazy.
Yeah.
I feel like once I got pregnant, now I just like naturally wake up and I'm like, I might go to the bathroom or not. It's not regularly, but like once I got pregnant and then had babies, it was like, I'm just so used to just waking up.
Yeah, that's not going to be sleep apnea necessarily. So, but if you it's when we start to see a lot of these red flags in conjunction
just
with each other
up.
that it's like, hey, let's just get tested. Let's find out what's going on. Let's see what your brain and your body is doing while you're asleep, and let's just find out.
So let's talk a little bit about why this is so important.
Yeah.
Right? Like, why is it so important that if you're having issues sleeping or any one of these things is kind of ringing a bell for you listening, why is it important for the listener to set up an appointment to get all these things looked into so they can improve their sleep?
The health implications that it has are enormous, just from the increased risk in heart attack, the increased risk in stroke, the longevity. So somebody that has sleep apnea, depending on the severity of it, it's anywhere from 6 to 18 years reduction in their lifespan expectancy. And so
that's not a small number.
It's not, no, and especially the increased risk of heart attack. So my father had his first heart attack in his 40s.
Wow.
And there's a family history of that.
Sure.
So when I was diagnosed with sleep apnea and I started recognizing kind of some of those signs, I'm like, I wonder how many of my relatives that have these issues have sleep apnea that is increasing their risk and increasing kind of that damage. And so, sorry, I kind of got off on a tangent.
No. I think it's totally fine. And one of the things that I'm thinking about, and I in general enjoy this kind of topic, and I think it's something we talk about a lot here on Invigor Medical is about how to take care of yourself, how to take charge of your own health, and I think I'm loving seeing kind of the shift that's happening in the medical and scientific field that's looking at kind of this more holistic and functional medicine approach to things. Because what I'm hearing here is it's like heart issues, low blood pressure, all of these other things that's happening, and you're going to a specialist and you're trying to figure out what this is, and they're doing this test and then they're prescribing this medication, whatever. And what I'm thinking is, if we start with, because I'm always thinking first food. Like food is medicine, medicine is food.
Absolutely.
And that's always where I'm starting to think, and that's a tough one too, though. But man, thinking about this and sleep, which I've always known how important it is, but more and more I'm learning how really important it is.
Yeah.
Thinking if you've got these bigger, issues, like coming back, it's just to the basics of like, how's your sleep? And what do we need to do to get your sleep on track? And then if that's not improving these other things, now let's go from there.
Yeah.
You know what I mean?
Yeah, absolutely. And too many times, like you said, it's like you go and you're like, hey, I have these symptoms and I have these signs. It's like, here, let's write you a prescription for that medication and take care of that. When, hey, the underlying problem, if we fix that, if we address that, we might get rid of all these problems that are downline from it, or at least help them. So one of our goals in any sleep physician or anybody that treats sleep apnea, one of the goals is always, hey, let's reduce the medication that you're taking. And it's amazing how many different medications are related to sleep and sleep problems.
Yeah.
So
Wow.
from the heart medications and blood pressure to anxiety and depression to all sorts of different things that are affected by it.
Yeah.
Well, and I'm thinking about too, like, thinking about the pillars of health and like your diet, your exercise, your sleep, your connections. But like if you're exhausted mentally and physically, it is so much harder to like come home and make a healthy dinner, or even to just like have the figure out what or make a meal plan, or like get up early enough to get to the gym before you have to get the kids to school and go to work. Like, it's just making so much sense to me that it's like needs more emphasis on the quality of sleep that we're getting.